Hi everyone. In today's clip, I will talk a little bit about tonsillitis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, tonsillitis is the throat's version of minor brief military clash between small groups of troops along the boundary between two countries. The tonsils stand guard, and when microbes sort of charge, they swell, redden, and sometimes turn the whole passage into a narrow canyon of discomfort. The causes can be either viral, which is most common, like colds, flu, Epstein-Barr virus, or it can be bacterial, especially for strep throat. So in children, we will see more frequent episodes with larger tonsils naturally and a higher chance of airway obstruction like snoring, mouth breathing, and it will it will be more likely actually to be viral. In adults, they are less frequent but more painful, often more painful, and there would be higher suspicion actually for bacterial infection or causes when it's severe, along with complications such as abscess and swallowing pain. So in general, the symptoms are sore throat, which is often severe, swollen red tonsils plus or minus white patches, fever, painful swallowing, swollen lymph nodes in the neck, bad breath, irritability, and poor eating, obviously because of the pain. And sometimes we will see peritonsillar abscess, like pus collection, severe pain, muffled voice. There could be ear pain, which is referred pain, and breathing difficulty if if tonsils are very large. So conventional modern medical treatment includes, for most cases, warm fluids, warm soups, rest, pain control, usually by acetaminophen or ibuprofen, as well as saltwater gargles. In case of bacterial infections, the doctor may prescribe antibiotics, and usually only for confirmed or suspected strep. The most common type is amoxicillin, and it's not used for viral cases, obviously. The doctor can also suggest tonsillectomy, which is removal of the tonsils. This really should be considered only if there are frequent recurrent infections and for certain reasons. So we need to remember that tonsils are very useful when they are doing their job well. They become candidates for removal only when they stop protecting effectively or become a chronic source of infection or obstruction. If someone gets repeated episodes of tonsillitis or strep throat, the tonsils can develop deep pockets and bacteria can hide inside and become sort of hard to clear. And each episode becomes easier to trigger. So basically, instead of stopping the infection, they harbor it. So typically the threshold or the guideline is based on around 7 infections in 1 year. The other case scenario can be airway obstruction, especially in children, and sometimes the issue isn't infection at all, it's just the original size. Large tonsils can block airflow and cause snoring, mouth breathing, and pauses in breathing during sleep, which will impact brain oxygenation, growth, and behavior, and also sleep quality, obviously. So removal is not the first step, but also not unthinkable if the tissue becomes chronically corrupted in its function. So, however, it also begs the question, why did it get there? So picture the tonsils as two little sponges at the doorway of the throat. When they're fresh, they filter well. But if they get overworked, scarred, or clogged, they turn into damp webs where trouble lingers. Repeated infections can cause structural change, and after multiple bouts of tonsillitis or strep throat, as I mentioned before, the tonsils develop those deep pockets and tissues become scarred and irregular. And the drainage worsens. So now instead of clearing the bacteria, they trap it, like a sponge that has been used for many times and never really fully dried up, sort of. So there can also be environmental and internal triggers, things that keep irritating the tonsils, such as allergies or even postnasal drip, dry air, pollution, acid reflux if the acids or the irritation reaches the throat. These don't cause infection directly, but they keep the tissue inflamed and reactive. As well as sort of microbiome imbalance, because the throat has its own ecosystem. If the beneficial bacteria in there are reduced, then harmful species obviously are going to gain ground. Infections become more frequent in that case, and the recovery becomes sort of incomplete. So healthy tonsils behave like flowing river filter. Problem tonsils are a stagnant pond with debris. So overall, even in the cases I mentioned, the key words were overworked, scarred, and clogged. The goal is to support the tonsils so they can do their job sort of without getting worn out or stuck. In order not to get to that state where they're going to suggest a removal, we need to first avoid overworking the tonsils. The tonsils are immune's sort of first responders. They get overworked when constantly triggered by infections or irritants. So reduce exposure to infections by washing hands frequently, avoiding close contact with sick individuals, and strengthen general immunity through adequate sleep. Tonsils get sort of resting period. Balanced diet rich in vitamins such as C, D, zinc, and antioxidants. Support of gut microbiome, because healthy gut equals less immune overreaction. So, secondly, prevent scarring. This sort of goes hand in hand with the first point that I just said. Scarring happens after repeated infections or trauma to the tonsil tissue. So, if we do what I mentioned just in the first point, we would not get to the scarring and don't need to sort of deal with this stage. And the third point was clogging, which again comes from trapped food, bacteria, and mucus in the tonsil crevices. If we care for our tonsils through hygiene, rest, hydration, nutrition, improved immune response, it will never get to this point so that we don't have to deal with it. One very important side note: never clear your nose harshly or aggressively. This can absolutely also affect the tonsils negatively. When you forcefully blow your nose, the pressure shoots upwards and backwards into the nasal passages and to the area behind them. This area connects to eustachian tube and the lymphatic tissues, including tonsils and adenoids. Repeatedly doing so will cause definite issues in tonsils and other areas, of course, and will cause lymphatic congestion in the area. And on top of that, will increase the amount of postnasal and nasal drip that you were actually trying to get rid of to begin with. Instead, blow gently, one nostril at a time. In orthomolecular medicine approach, we look into optimizing nutrients to support immune response and reduce inflammation. And the key nutrients in this include vitamin C, which is often used in higher divided doses, vitamin D3 plus K2 to regulate immune response, and the fact that low levels of vitamin D is actually linked to frequent infections, as well as zinc to support immune cell function, and it also can shorten the duration of the illness if you already have tonsillitis. Quercetin, which is anti-inflammatory and mast cell stabilizer, and probiotics for gut immune axis support. The other factors would be hydration plus electrolytes, warm herbal teas like thyme and sage, avoiding sugar and heavy mucus forming foods during acute phase, such as milk and dairy in general. In reality, or in really traditional and old school ways, we saw tonsillitis as an imbalance of heat plus moist congestion in the throat. So we would attend to cool the excess heat, thin and clear the phlegm that might be there, and soothe the tissues gently. This was done through giving the patient warm barley water, which is cooling and anti-inflammatory, honey water, which is soothing and antimicrobial, light vegetable soups and broths, stewed fruits like figs, apples, and pears, and we stayed away from raw fruits and vegetables for the duration of recovery. Also, throat gargles with heavy salt water, or sumac solution, and this was to tighten the tissues and reduce swelling and kill any virus or bacteria that might be present. Topically, we use violet oil or rose oil, which was applied externally to the neck area and massaged gently, or castor oil wraps. The patient had to avoid heavy, oily, and thick foods, and as I mentioned before, dairy during acute phase, stay away from cold exposure to the throat, and of course, try to rest. So basically, we tried to control the fire, nourish the system, and clear the blockage, and this was immensely effective. Hope this has been helpful. My clips are also available on Rumble, TikTok, and YouTube. Like and follow for more. Be the light.